The next process, excretion. Excretion. Its definition. This is a movement of drug out of our body. So you can see the definition. Excretion is the passage out of systemic administered drugs. Another sentence is right, that is removal of drug and its metabolism from body. Maybe you can see another word. This is a function of removal or elimination from our body. Yeah, this is also right, I think. Yeah, removal drug and its metabolism from our body. So this is excretion. And the major process of excretion is from urine. Urine. So the major organ is what? Is kidney. Is kidney. Okay, others like the feces and air and salivary, water and milk also can be the passage of excretion. Okay, kidney. This is the most common majority organ that in charge of excretion, and because it has three phenomena are involved: the filtration, reabsorption, and the segregation. And the first one is filtration. Filtration, I have told you, this is aqueous. Yeah, aqueous diffusion. So because this is the first step, so it requires a water-soluble substance. No matter this is a prodrug or the metabolite. Yeah, just needs this is water-soluble substance. It can be filtrated to the kidney tube. So the net renal excretion is glomerular filtration plus tubular segregation, and minus the tubular reabsorption. These two steps will from the blood to the tube, and the reabsorption is from the tube back to the blood. So they have different direction. And the second one I want to tell you, segregation. This is active transport, and the reabsorption. This is simple diffusion. Yeah, this is a basic point that I want to point out. Okay, let's see one by one about these three steps in the kidney. Glomerular filtration, yeah, from the blood to the renal tubules, and it needs just one requirement, that the prodrug and the metabolite, they are water soluble. So if a drug is water soluble drug, it can pass by the metabolism and directly into the kidney. But for a lipid soluble drug, it will first experience the metabolism and then change to a water soluble metabolite that can come to the kidney and do the excretion. So this is their difference. Okay, the second one, tubular reabsorption from the renal tubes and to the blood back to the secretion. Okay, some will influence this process and influence the drug secretion. You can see here, because this is reabsorption, this is a simple diffusion, especially the lipid diffusion. So can be influenced by the drug concentration gradient and by the the drug's lipid solubility and the pH. Let's see. Okay, I give you an example. If this is an acid drug, and will be saturated major by the tubular reabsorption. Okay, and when it located in I think acid urine, and the second compared to the neutralized urine, the acid urine will increase its secretion or decrease its secretion. Acid drug in acid urine, its secretion will increase or decrease. Okay, just tell me. We have learned it. Acid drug in acid urine and compared to some neutralized urine, what's a change about its secretion? Decrease or increase? Yeah, let's review, because I have told you the pH influence on the simple diffusion. You must review, okay? Hello? Do you understand my question? Not about the pH, I said to you about the secretion of this drug. Acid drug in acid urine, what will happen compared to the neutralized urine? Okay, let's do it together. We can give you 2 pH. First one 7, and the next one maybe 3, maybe 5. Okay, here is an acid drug, and will maybe dissolved in this urine, and maybe will dissolved in this more acid urine. And what about its secretion? We can see here, because acid drug in acid urine, and the majority of form is I think is non-ionized. And maybe you can see molecular form, so it's more lipid soluble. Yeah, it's more lipid soluble, so it can be easily cross membrane, and from the renal tubular back to the secretion. It means its reabsorption reabsorption will increase. So compared to this condition, its secretion will do what? Yeah, reabsorption is very strong, so its secretion will decrease. Okay, compared to the neutralized urine, the acid drug in acid urine, its reaction will decrease, because its reabsorption will become strong. Yeah, this is ionized form takes up most. Now, clear or not clear? Clear or not clear? Okay, say it again. This is pH influence on the drug's secretion. Acid drugs in acid urine, its secretion will decrease, because in this acid urine, the most form of drug is non-ionized. So it means more lipid soluble. So it will take strong reabsorption. This action will be strong. And because reabsorption seems the drug will from the tubules to the capillaries to the blood, if this action is strong, its secretion will decrease. Okay, the second sentence. When we use an acid drug in a basic urine, its most of the form is ionized form. And then it's become hardly cross-membrane, so the reabsorption will become weaker. So the secretion will increase. Yeah, this is just the action of reabsorption on the secretion. Yeah, reabsorption. Because reabsorption, I tell you, this is a lipid diffusion. Okay, now clear note. We can use the acidified urines to increase the secretion of acid drug. And also we can use alkalinify the urine to increase the secretion of basic drug. And now, clear not? The last one, the tubular secretion. This is the drug from the capillaries back to the renal tubulus. And this is active transport. I have said to you, active transport. And different drugs have different carrier. Like some acid drug can be transferred by the OAT, organic acid transport. And the basic drugs can be transported by the OCT, organic base transport. So it means the acid drug cannot be competitized by the basic drugs. Now let's see two combinations that rely on the tubular secretion. You should know it very well because this is very important. Important combination. First one, let's see. Two drugs. One is penicillin. Another one is probenecid. Penicillin, this is exogenous substance, and its secretion rely mostly on the tubular secretion. By the tubular secretion, the penicillin will come from the blood and to the tubule. Here, by the secretion, this is active. I will tell you, active transport. And next one, we use another drug, the probenecid. Probenecid will prevent this process. Present the tubular secretion of penicillin. After that, because probenecid prevent the tubular secretion of penicillin, that will decrease its secretion and decrease the penicillin from the blood to tubular. So will increase the concentration and the duration of penicillin in the secretion. Because its secretion will decrease, so will increase the concentration or the duration of penicillin in circulation. Okay, you can see the result. Penicillin will retain in the body. Okay, for this example, the combination, clear or not? Clear or not? I think this is not difficult. You just to put your emphasis on the secretion of penicillin, mostly by the tubular secretion. If you know that, I think it is clear, because probenecid will prevent the tubular secretion of penicillin and make more penicillin cannot move from the capillaries to the tubulars and increase its concentration and duration of penicillin in the body. Okay, this I tell you once again. I think you understand. Okay, next combination. It's also an action of probenecid on some substance secretion. We can see it refers to endogenous substance, the uric acid. Uric acid it primarily undergoes tubular reabsorption. And the poor benefit will prevent the reabsorption of uric acid, and then will decrease the uric acid from where? From the tubular back to the blood. So will increase the concentration of uric acid in where? In the tubular. So will increase the concentration and the duration of uric acid in the urine. Okay, for these two combinations, especially the first combination, do you understand? Give me answer. Give me a reply. I don't know if you can master that or not. The combination. Yeah, because some question will ask you, what's the purpose of we use probenecid after the application of penicillin? What's the purpose? You must understand. Well, increase the duration of penicillin in the body and increase the intensity of penicillin in the body. You must know that. As student, do you clear or not? Okay, I just regard you understand this. So, when we discuss the excretion of drug, it become weaker or become strong. We first wanted to know which process of this drug, which process is the secretion of this drug. This is major by the reabsorption or major by the tubular secretion. Yeah, this is firstly. We must know this point. And after that, we just know if this drug is majorly secreted by reabsorption, we must discuss its lipid solubility, its ionized form and unionized form. And while the drug is secreted majorly by the secretion, we must to understand the function of carrier, the ability of carrier to know, what will be changed about its secretion. Okay. Another form of excretion, like what? Like some intestine. Yeah, the prototype drug or some metabolite will become feces because unabsorbed, and well from a bear. And if drug secreted by a bear, here is a phenomenon we call what? Enterohepatic secretion. Enterohepatic secretion. According to its name, we know this secretion will exist between the intestine and the liver. And repeatedly movement from intestine to the liver, and then to form the bile, and from liver to the intestine. This secretion we call enterohepatic secretion. Some drugs have this secretion, like the erythromycin and the tetracycline. And what's the clinical application? what's important fact? We know if a drug exists, the enterohepatic secretion. It means it can cycle and cycle for several times. So you should know the clinical implication. If a drug has this secretion, it means it have a long duration. Long duration. Because it can located in our body for a long time. Yeah, because of the secretion. So you can see. Okay, next process, like the lung. Yeah, the drugs will become to the air and be eliminated. And from some skin, yeah, and from the hair, this is all the process of excretion. And from some milk, if a drug can excreted by the milk, it means noticed the drugs act on the mother, and also you need to notice it have the action on the baby. Yeah, you must think about two objectives. Next one about some saliva. Okay, so this figure, let's do some conclusion to the whole in vivo process. We just review it. 4 processes: absorption, distribution, and biotransformation, and the last one is excretion. And these two will make the drug increase in the body, and these two will make the drug decrease in the body. Yeah. Okay, this is the whole process. And to this, for these two processes, biotransformation and excretion, you should review it according to this question. Okay, next, let's